19 News, sponsored by Kissling, Nestico, and Reddick. Heard in a car? Call KNR. This is 19 News.
Well, CPR guidelines are changing, and it's the first time this has happened in the last 5 years. This is coming from the American Heart Association, and it's a big deal for several reasons. These changes not only expand upon life-saving care, but also who is recommended to be trained for it.
So joining us now in studio this morning to talk all about this is Dr. Peta Aziz, who is a pediatric cardiologist at Cleveland Clinic Children's, and of course is Sonia Vesmir, who is with the American Heart Association. So first things first, just talk about some of these totally new things with these guidelines. The first is that now there's training included with cases of suspected overdoses.
Yes. The World Health Organization has said that opioid use can affect your your rate of breath, and so it's important that in the case of a suspected overdose, if you're a trained rescuer, you should use either rescue breaths or a bag valve, a mask to provide rescue breathing. Or if you're a layperson, so just a regular bystander on the street, you should perform CPR breaths as well. And it is safe to provide naloxone to a person that's suspected of overdose. Anyone can do it.
The other big change, too, with guidelines is the age. The children now as young as 12 can get certified for CPR.
Yeah, thanks for having us. Thanks for the question. Yeah, children as old as 12. So there's studies actually that show that 12-year-olds are as effective as performing CPR as trained, first responders, which is incredible. So this broadens the reach, I think. It's important to know that more than 70% of all cardiac arrests happen outside of a hospital setting. So people in the community that are equipped, that are ready to go, that know what to do, even 12-year-olds can help save lives.
Yeah, especially if they're out playing with each other and something happens, now they can give that life-saving care. So tell us, too, about how the American Heart Association is really just trying to be in the community and provide those life-saving tools, especially when we talk about youth and sports camps or teams.
Yes, actually, we are committed to creating a nation of lifesavers. So as many bystander CPR rescuers in place that we can. We want to have at least one person in a household that knows how to do CPR. And so locally, we're currently working with community organizations, businesses, and schools to create cardiac emergency response plans. And those would help to make sure that people have AEDs available, are trained in CPR, and just know how to do. So we're starting with our youth sports organizations. We have our local CPR and youth readiness impact manager, who is Amber Higbee, and she is leading that, heading that whole program. And we are excited to get some youth sports involved where we'll have them trained and ready to go should a sudden cardiac arrest take place.
And to wrap things up here, if anyone's interested in getting their teams or community organizations involved in CPR certified, where can they go to learn more or sign up for that? Yeah,
they can just go to our website, which is www.heart.org/Cleveland, or they can reach out to Amber Higbee. I think if you actually Google her name, it'll come up. Yeah, I don't want to go and do all that. So, yeah.
Well, thank you so much to Dr. Aziz.
Yeah.
Again, a pediatric cardiologist with the Cleveland Clinic Children's, and of course, Sonia with the American Heart Association for joining us and just breaking down these new guidelines. I mean, the first time in, 5 years that we've seen some new information. So thanks for joining us.
Thank you.
Now you're